Hello and welcome to the MEDSURG Nursing Journal podcast series. This series provides extended content related to articles published in MEDSURG Nursing, the official journal of the Academy of Medical Surgical Nurses. In this episode, Dr. Dottie Roberts, editor of MEDSURG Nursing, interviews Dr. Peter Buerhaus, who is a professor of nursing and director at the Center for Interdisciplinary Health Workforce Studies, College of Nursing, Montana State University in Bozeman, Montana. Here, Dr. Buerhaus discusses the projected outlook on the worsening nursing and healthcare provider shortage, why nurse practitioners may be an achievable solution to the crisis, and his recommendations to successfully overcome the shortage. He specifically addresses the role of medical surgical nurses and how they, with their strong direct patient care experience and leadership, can impact the future of nurse practitioners. We are pleased to now present Dr. Roberts' interview with Dr. Buerhaus.
Hello, this is Dottie Roberts, editor of MEDSURG Nursing. I'm very pleased to welcome Dr. Peter Buerhaus to today's podcast. Dr. Buerhaus is a nurse and a healthcare economist who is well known for his studies and publications focused on the nursing and physician workforces in the United States. He is a professor in the College of Nursing and director of the Center for Interdisciplinary Health Workforce Studies at Montana State University. Before going to Montana State, Dr. Buerhaus was the Valerie Potter Distinguished Professor of Nursing and Professor of Health Policy at Vanderbilt University, an assistant professor of health policy and management at Harvard School of Public Health. Dr. Buerhaus maintains an active research program addressing the economics of the nursing workforce, forecasting nurse and physician supply, developing and testing measures of hospital quality of care, determining public and provider opinions on issues involving the delivery of healthcare, and assessing the quantity and quality of healthcare provided by nurse practitioners. With these areas of research and practice interest, he is well able to help us review problems and potential solutions in healthcare. Well, Dr. Buerhaus, let's begin by clarifying what primary care is and how nurse practitioners come into it.
Hey, greetings, Dottie. It's good to talk to you, and I'm really pleased to be talking to you about primary care, which is increasingly important both for patients and for our healthcare delivery system, for the costs of care, and for the well-being of our nation. So I think it's a great first question. What are we talking about with primary care? And I think you can think of the conditions. Let's start there. So you can imagine people with hypertension, diabetes, asthma, angina, depression and anxiety, back pain, arthritis, chronic obstructive pulmonary diseases, and other factors like basic maternal and child health care services, things of that kind, things that a lot of your readers of the journal are very well aware of that you see in the hospital setting. So they're common conditions, they're important conditions, and I think primary care brings in an integrated approach to these conditions. It helps to think of primary care as a sustained relationship with patients, and it's practicing more in the context of the family and the community. So that's how I look at primary care. It's got a lot of value. There's been a lot of studies to show it lowers costs, it decreases hospital and emergency room use, it improves health, prevents illness, and lowers mortality. So it's a basic part of our healthcare system, and in other countries, it is really the dominant form of healthcare. Most of our history has been, in this country, primary care given by physicians. But things changed back in the 1960s, when there was a shortage of primary care physicians at the time, and physicians and nurses at the University of Colorado came together to figure out how could nursing develop a new type of practitioner who could address some of the shortage of primary care issues. And the nurse practitioner was born at that time. And then finally, I would just say there's a growing number of nurse practitioners. It started kind of slow in the growth of NPs in the 70s, picking up in the 80s and 90s, and in more recent years, just exploding. But maybe we'll get into that a little bit later.
Okay, thank you. So with that background, why do you believe America's primary care is in crisis? And what is it you think that's led us to that crisis state?
I think the crisis is that we, in 2018, within the past year, the federal government reported an estimated 84 million people have inadequate access to primary care in this country. And they also said that there are about 7,200 health professional shortage areas. So areas that the government says you're short in supply of health professionals. Now, those numbers have grown. We're not getting better here. A few years before, back in 2016, it was more like 60 million people with inadequate health care and 5,900 health professional shortages areas. Now we're seeing a growth in the overall number of people without good access. Many of the folks that, well, let me pause there and just say, so the demand is growing. Now, the supply side of this is not so good. There's a projection by the Association of American Medical Colleges that we'll have roughly a shortage of 50,000 primary care physicians by the year 2030 and 73,000 non-primary care physicians by the year 2030. And these are important because these shortages are getting worse, not better. And I brought in the non-primary care physicians because primary care is a fair amount is actually provided by specialists. We don't often think of that, but I've seen work that shows anywhere from 20 to 35% of primary care is given by specialists. So growing demand and a shrinking supply of physicians. And then a third part of this answer is that the physicians that we do have are not located in all the areas where we need them the most. Physicians are less likely to be working in rural areas or underserved areas. And as we look to the future, we see that the projections of physicians working in rural areas is declining. So we've got some real problems of growing demand, inadequate supply now, much more inadequate in the future, and physicians are not practicing where we need them the most.
So you've written about nurse practitioners as a potential solution for this crisis. Please tell our listeners how NPs can help the nation address some very specific healthcare needs.
Yeah, so, we just talked about the physicians. And if you look at nurse practitioners, it's almost the flip side of it. We have growing numbers of nurse practitioners. And in fact, the projections that we've published show that between now and 2030, we'll more than double the number of nurse practitioners. The annual growth rate of nurse practitioners will be almost 7% annually per year, where the physician supply is growing at about 1% per year. So strong growth in the numbers of nurse practitioners. Second, we have published studies, as have others, that show that nurse practitioners are far more likely to be practicing in rural and underserved areas compared to physicians. So they're practicing exactly where the needs are greatest. Other studies that we've done, and many, many others, show that the care provided by nurse practitioners is as good and in many cases better than that provided by primary care physicians. And as we've recently published, the cost of care, primary care, provided to Medicare beneficiaries, some of the most complicated, complex patients that we have in society, multiple chronic conditions, cognitive issues, you name it. They're a very complicated group of patients. We see that nurse practitioners provide as good or better primary care to Medicare beneficiaries at a lower cost, between 10 and 30% less compared to that of physicians. So that's why we think that the nurse practitioner workforce is really a solution to this otherwise growing crisis.
I think, with that perspective, we go then to the next question about restrictions. What are some restrictions on nurse practitioner practice that need to be addressed to make this happen?
I think we could look at the restrictions as originating at the state level. And here we see that around the country, almost half of the states do not restrict the practice of nurse practitioners. But about 16 states reduce the practice, and 12 states really restrict the practice of nurse practitioners. And in those states, they will govern your medication prescribing practices. You have to be supervised directly by physicians. They're really sort of closely watching over and reducing the autonomy of nurse practitioners. So you've got, this patchwork of state regulations that largely is a result of old-fashioned, antiquated models of regulation of these workforces of nurse practitioners. Most of it is driven by physicians, or not all physicians, but some physician groups who perceive that if they were to reduce these state-level restrictions, they might lose patients, their incomes might go down. And so they look at this relaxation of restrictions as nurse practitioners winning and physicians losing. That's how they see it. And it's not the case, but that's sort of how many of the professional associations that physicians listen to in this area, that's how it's communicated to them. So they're fearful and they're resistant about these regulations, and they maintain them to protect their economic interests. Now, that's one level of restriction. The second level of restriction has to do with how healthcare delivery organizations, health insurers, and healthcare systems respond to nurse practitioners. And they can impose restrictions on what NPs do, even though the state may say, you're free, you have open practice, full practice authority, a organization can come in and limit what the NP does. And that's often, again, to sort of acquiesce to a hospital, or more likely the medical staff, who see themselves as potentially threatened by nurse practitioners. So you have that level of regulation. So some states, you're free and open practice, but you can go in and find examples of where NPs are heavily regulated. So that's sort of the regulatory perspective. Now, one thing we can say about this is, not only have my team looked at this to see, does this actually reduce access to primary care? And we find that it does. It has a dramatic effect on people's access to care. In fact, we find that in states where there are no restrictions on nurse practitioners, about 35% of the population in those restricted states have good access to primary care. But the states that don't restrict nurse practitioners, you find that about 65% of the population in those states have good access. So access is doubled when you remove these state practice restrictions.
That has real implications, I think, for vulnerable groups, wouldn't you say?
Oh, absolutely. We have recently published a study on what we would call vulnerable Medicare enrollees, those who are duly eligible. And what that means is that Medicaid will pay for the premiums that are charged in the Medicare program. So these individuals are often very, very poor, so poor that they need both Medicaid and Medicare. A second group that we've assessed in Medicare beneficiaries are those with a disability, and they tend to be complicated, many of them complicated with regard to their health care. And so we've looked at both populations, and we find nurse practitioners provide very, very strong care for these populations, no different, and in many cases better than what has been provided by a physician.
Wow, that's interesting and profound. What are 3 recommendations you would offer to facilitate the delivery of primary care in this country?
I think that the first thing I would recommend is that people who are concerned about primary care in this country, access to it, should find ways that we could sponsor forums to bring primary care nurse practitioners, primary care physicians, representatives of their professional associations, policymakers, hospital representatives, others, to sit down and actually talk to each other. Get past this idea that if you win, I lose, a zero-sum game, but actually think through, the needs of the population and who is providing what. And if we expand our opportunity to bring nurse practitioners more into the fold, what would be the consequence for our patients and those without access? So, in other words, listen to each other, understand what fears are driving the others, correct those. For example, a lot of physicians feel that, my gosh, if we take these restrictions off of nurse practitioners, all these NPs that are being produced are going to go out and put a shingo up and compete head to head. That's just not going to happen. Today, about 85% of all nurse practitioners are working with physicians, but physicians often have the wrong impression of what could happen. But we need forums to bring people together and start talking with each other and listening to what the concerns are of each other. That would be the first recommendation. The second thing I would do is to get to the physician leadership that basically says, look, there is a mountain of evidence. There is 4 decades worth of evidence that shows that nurse practitioners provide quality health care to people in need. And I think in my experience, many physicians, in fact, I've not ever met a physician who's ever read any of the studies about nurse practitioners. They are uninformed about what the measures are, how the studies were conducted, the findings. It's not what they've been reading, and certainly these studies are not brought to them by the organizations that represent them. And I'm not criticizing them, physicians, that they're unaware of these studies. But what I'm suggesting is it's time, given the rising numbers of people without access to primary care, it is time to get informed about what can NPs provide and contribute and start to take that into account. That's the second recommendation. The third recommendation is that public policymakers, those at the state level, should drop the restrictions on the primary care nurse practitioner's scope of practice. These restrictions are not supported by the evidence, just the opposite. And by dropping these restrictions, this will help promote, I believe, the interchange of physicians, nurse practitioners, and policymakers to begin to say, look, let's examine the needs of the population and figure out how we can use our combined resources the most effectively to take care of the population. And I think what we should, keep in mind is every state is going to be different. Every area is going to be different. And we should work around the needs of the population that maximizes what the two respective professions can bring, and do it in a way that allows for physicians to respect what NPs do, NPs to respect what physicians do, and realize things are not set in stone. We can evolve, things can change, we can modify our approaches. It's not set in stone. But let's really be focused more on the needs of the population and less on protecting our own interests as a profession. So those would be the 3 recommendations I would have. The forums to bring people together, the need for physicians to become more aware of the strength of the research showing good outcomes of nurse practitioners, and then policymakers getting rid of these restrictions that they impose at the state level.
Most of the journal's readers are clinical nurses who are in bedside practice every day. Dr. Buerhaus, as we approach the end of this podcast, do you have any concluding thoughts specifically for this group of nurses as they consider their roles in a changing healthcare environment?
Yeah, Dottie, great question. And I think I have 2 thoughts. One is that I hope the MedSurg nurses appreciate just how vital and important they are in healthcare. It's tough work. It's how I got my start. And it is challenging work. It can be extremely rewarding. And one way to maybe link this towards primary care is that many people, nurses, They come into a new environment. They're out of nursing education programs, and they're getting experience for 1 or 2 years. And then they move on to go into nurse practitioner programs. So the med-surg nurses that are there are extremely important to help people get the education and skills needed to go on to be a nurse practitioner. And not just the clinical skills, but there's something else, I think, which is personal leadership. I look at the med-surg nurses as examples of leaders, not just nurses. It's how they behave. It's what they say, and it's how they say it. My own wife, when she was getting her BSN, I knew when she had a good clinical day because she was around a med-surg nurse who behaved like a leader, who said the right things, and she said them in a way that people listened to and respected. So we can all come to work being very much aware of how we behave, what we say, and how we say it. And the med-surg nurse is the spot where so much of that is important to growing our future supply of nurse practitioners. I think the other thing I would say is you're in this inpatient world of med-surg. Outside that world, there's a lot of policy that is trying, of course, to get more health care provided in the community settings and more into primary care, integrating behavioral health care into primary care. It's slow work, but it seems to be backed by both private policymakers and public policymakers. That's the trajectory of a lot of healthcare. So it's important to get connected to primary care, community care. And anytime you can understand what's happening in your communities, maybe get to volunteer and spend a little time in some of the clinics and other settings, that could help you gain a larger grasp of what's going on in healthcare and a better way of informing your patients around discharge. You can say, hey, you'll be going to this clinic, look up, Martha, she's there, she can help you. And if you're over here, there's a person by the name of Ron, and he can help with your needs there. So it can help that discharge planning process if you're more aware of what's going on in your community, and particularly in primary care. So beyond that, I can't think of anything else at the moment, Dottie, but I think it's a great question, and I hope your readers will sort of ponder that and do better than the answer that I've just provided.
Well, I appreciate your sharing your thoughts with them because they're definitely valued members of the healthcare team, and I like to see them get all the credit they possibly can. Like you, I started as a med-surg nurse. I'm a clinical nurse specialist by preparation, but I still have that tie to the bedside. So I appreciate your, closing this podcast by bringing them into the discussion as well. So thank you.
Absolutely.
Thank you again for joining me today, and I'll be very excited to share this discussion with the journal's readers and with nurses throughout the country. Thank you, Dr. Buerhaus.
Thanks very much, Dottie, and best wishes to you.
Thank you.
The MedSurg Nursing Journal podcast series is owned and produced by Genetti Publications Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Peter Buerhaus is a professor of nursing and director at the Center for Interdisciplinary Health Workforce Studies, College of Nursing, Montana State University in Bozeman, Montana. Dr. Dottie Roberts is editor of MedSurg Nursing, the official journal of the Academy of Medical Surgical Nurses, and a clinical nurse specialist and nursing instructor at Walden University in Lexington, South Carolina. For archived episodes of this podcast and to learn more about MedSurg Nursing, the official journal of the Academy of Medical Surgical Nurses, visit the journal's website at medsurgnursing.net. You can also subscribe to the MedSurg Nursing Journal podcast series on iTunes, Spotify, Google Play Music, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services. And as a listener, you can save 50% off your first-year subscription to MedSurg Nursing. Simply visit medsurgnursing.net/offer to take advantage of this special discount.